COVID-19 cases here in Metro Manila and other critical areas are still on the rise almost a month since quarantine guidelines were relaxed. How high is the risk of infection now that more people are out of their houses? To help us understand, we now talk to Dr. Karl Henson. He's an adult infectious disease specialist and director of Hospital Infection Control and Epidemiology Center of the Medical City. Good morning and thanks for joining us, Dr. Henson. Now, there's been a steady increase in the number of COVID-19 cases in the country. Can you explain to us why that's so and how high is the risk of infection now that many parts of the country have relaxed quarantine?
All right. Hi, Ria. Good morning. Thank you for having me on the show again. So you're asking about the rising number of cases all over the nation, but particularly in NCR and Cebu. Well, there are several reasons. Probably one is I think we're testing more. Our lab capacity has increased from when compared to early March. So we now have 50 or so laboratories doing the tests. But also I think, so we're seeing less and less cases of, at least in the medical city, we're seeing less and less cases of severe COVID-19. So at least from my experience, I think the rising number of cases has more to do with the increased testing capacity, and we're testing more and more people. But also, we cannot discount the fact that symptomatics still are transmitting the virus, and that's why I think the next part of our conversation will be important, which is how to protect ourselves from getting infected.
Right. Before we get to that, Dr. Henson, I just want to ask, what is the benefit to reporting cases as recent cases and the backlog cases?
I think this information had to be available even earlier on rather than much later, because they only started reporting the backlog versus the fresh cases maybe as late as 2 weeks ago, if I'm not mistaken. But it's important for us to get a sense of how many cases we're seeing in the past couple of days, and not muddle that up with backlog cases. Yes, it's important to get the bigger picture, like how many cases in total, but it's also important to see how many cases we're diagnosing in the past couple of days, because it will allow us to see whether we're seeing an uptick, we're seeing a real uptick in the number of cases as against like a false one because of artificial increase from like backlog from like 10 days ago. Remember that earlier on, at least in March, we were getting results 10 days, 14 days from the time that we submitted the samples to the lab. And that really, the patients had to stay in isolation for a long time before we could release them with a negative result. So now we're getting results faster, but then we're seeing that some of the backlogs are still being dealt with, I think. So it's important that we get the results as fast as we can so that we can make a disposition for patients, but also so that we can define what the current situation is.
Absolutely. Now, let's talk about the places and areas where the risk of infection is high. Over the past few weeks, we've been seeing people lining up in train stations, strolling around in malls, even dining in restaurants. And of course, physical distancing measures are in place, but are those safe enough for people to conduct these activities and contain the spread of COVID-19?
Well, first of all, I think we need to understand why the decision was made to start opening up the businesses, right? We need to strike that balance between taking care of our health versus taking care of the health of our economy. I think it's critical that we now look at the health of the economy as also being very sick. So I think that at this point, at least in the NCR, we may make some allowances for opening up of business, and that's why as individuals, it becomes much more important for us to remember the most important ways to protect ourselves. There are really four things that people need to remember when they think of protecting themselves, and those are the very basic things of hand hygiene, universal mask wearing, or wearing masks in public all the time, physical distancing, so you need to keep yourself 1 meter from the next person, whether that person is symptomatic or not. And then, of course, they need to think about properly disinfecting the items that they bring out of their houses. And before they bring it back into the house, they need to think about cleaning those things up.
All right. Thank you so much for your time this morning, Dr. Karl Henson, who is joining us.